Hi, everyone. Please give me a minute while I share the screen. Okay. Today we will be discussing betrayal trauma. I will be focusing on acting out husbands. In other words, female betrayal trauma. Again, this could possibly be the other way around, where a woman would be acting out and the man would be experiencing betrayal trauma. But for today, we are going to be focusing on women who are experiencing betrayal trauma. Like a lightning bolt, I woke up to the truth of your lies, a jagged, scorching jolt, tears, pain, and a million whys. Discovery. Discovery is when she finds evidence of her husband's acting out. He may be watching things that she wasn't aware of. He may be talking to women that she didn't know about. And it's a huge range, but the experience, interestingly, is similar. And these are the normal reactions to discovery. That is, she may have doubts about her desirability. She may have doubts about his past love. She may be doubting the words he says, doubting her goodness with Hashem. What did I do to deserve this? She'll have doubts in people in general and feel anger at his friends and family because they must have known and not told her. She'll have thoughts of should have married someone else. She'll have doubts in the religious community. How can Frumkeit be good if Frum people do things like this? And then she's going to get bad advice that will further traumatize her. People will tell her, always say yes to him so he won't stray, which is not a fact because addicts will be doing these activities no matter what she does or doesn't do. They may tell her to lose weight again, which will likely have no effect on whether or not he engages in these behaviors. They may tell her to be nicer, same thing. It won't change things. She may go to a marriage counselor that does not specialize in sex addiction, and then they'll focus on things like communication that, yes, they're wonderful things, but she may feel invalidated or and unheard. Um, they may tell her to ignore it. It's just a phase. He will come to his senses on his own, which he will or won't. And then all men do this. Boys will be boys. That's just not true. Many men do not do this. So why do addicts use? They used one of two reasons, and it could be both reasons, general reasons. One is to numb pain, which is they some at some point the addict discovered that this addiction works for quieting the pain. So what sort of pain? For example, if somebody has OCD or intrusive thoughts, and the only thing they discovered that works would be pornography. So they'll just use it to quiet the intrusive thoughts. And also there's the possibility of a dopamine hit that is addictive. Say he was 14 years old and he landed up on a porn site and got that feel good chemical that porn produces, dopamine, and then did it again because it felt good and did it again and felt good until he got addicted to it. How do I know if this is addiction? So this is the DSM criteria for addiction in general. I think you need 5 out of 8 or 6 out of 8. I don't remember how many, but you need a couple of these for it to be considered addiction. So unsuccessful attempts to stop, like he tries and it doesn't work. On it longer than intended. He wanted to be on for 15 minutes. He ended up losing 3 hours of his life. Strong cravings to use, not managing to get work done, continuing to use even if it causes relationship problems, giving up recreational or social activities to use, tolerance. So tolerance is like for alcoholism, if what used to be one glass of wine to give you that feeling, you then need two, then three, then four. So in these addictions, it would be either using more of it or the behaviors would get worse. And then there's withdrawal when not using, like he may get agitated whenever he tries to go without it. So why are we seeing so much of this now? So the 3 A's are accessibility, affordability, and anonymity. Accessibility, it's in his back pocket. He can reach it whenever he wants. Affordability is it's should be free or very cheap. And anonymity is no one's ever going to know that it's him, so he can get away with it. So what CSATs do, which are certified sex addiction therapists, we have a plan for recovery. We want your marriage helped. We want you helped. We want, the addict, the partner, and the marriage to be helped. So we use three different CSATs. The addict works on his recovery. So he'll work on his sobriety, meaning we want to theoretically destroy the stash. So in the case of porn, either switching him to a flip phone or a really great filter. And then the real recovery can start where he can understand how he got to this point in the first place. Like why would a guy with values, like say religious values, how could he land up watching this stuff even though he's not morally aligned to it? Partner recovery, also a CSAT or an APSAT specializing in betrayal trauma. And then there's grief work because the relationship is never going to be what it was. It may be better because after doing this work, people really have amazing relationships, but you still have to mourn the loss of the old relationship. And then there's boundary work and emotional regulation work, and then individuation and self-growth. Like who are you? What interests you? What fuels you? Because if the addict is stuck in his chaos and he's working on his sobriety and there'll be ups and downs and slips, and you don't want to fall apart whenever he is having difficulty with his sobriety. So you'd like to have your own life and your own interests. The goal is for post-traumatic growth. We don't want you destroyed from this. We want you to grow from this. Like God also decided that this should happen to you. I know the addict did it to you, but nothing happens without God wanting it to happen. So what did you learn from all this? How have you grown? So for marriage recovery, most people like doing a disclosure. I like doing disclosures too, because the partner really needs to know the scope and what happened in the addiction. So it's like you prepare a document with like a timeline with the basics of you know, what the addiction looked like. And some people will insist on a polygraph because they may be feeling a lot of anxiety and not knowing what is true and what isn't. A polygraph is a lie detector test. People feel a lot of relief when they know things with certainty, and this usually will give people that feeling. Then there's an impact letter where the partner tells the addict how it affected her, and that will help with his empathy so he can fully recognize what he did to her. Then they'll work on communication skills, emotional regulation, how to argue right, and then there's intimacy reintegration because this was a sexual wound. So getting them back together again physically could take some guidance. Remember, addicts are responsible to help her heal. This is different than traditional marriage counseling. It's not even he really needs to put in the effort to help her heal. So please reach out if you think I can be of service. Everything is absolutely confidential. I could be reached at 647-831-3730. You can text me at that number or email at dinahcohen@gmail.com. Thank you.